Hi, Dr. Joseph Damiani here. We hear a very similar story among all back pain and sciatica sufferers, which is since this whole mess started for me, there have been periods of time where I've been pain free, I've been able to get out of pain, but I've been unable to stay out of pain. Unable to stay out of pain long enough to get back to the things that I really want to do that make me feel like myself. Every time I climb back up that ladder, somewhere along the way, right when I get close, something happens and I slide right back down. And the reason for that is because getting out of pain and staying out of pain are very different. Anyone can get out of pain. I mean, and you have so many options. You could do PT, chiro, massage, acupuncture, stretching, injections. It's not that hard to get out of pain. But to stay out of pain, it puts the ownership on you, and it takes a little more work. It takes education. It takes having strategies that you can use on your own for the long term, and it takes information. And that's what we found here at the clinic to get all of our chronic patients and patients who have failed treatments over that hump, to allow them to get back to what they love. And not only get back to it without the fear of re-injury. Because when you just go from relief to back to what you love without the educational component, you're almost confused as to how you got there. And every day you're like, oh, I hope it doesn't come back again. You haven't empowered yourself with anything to mitigate that risk. And when you have a fear when you're doing or about to do the things that you love, you might as well be in pain because fear is like 10 times worse. So, how are we going to get that all across to you in our webinar? Well, we're going to simply take the same exact information and protocols that we do with our patients and give them to you for free. So, we're going to go over the two major causes of spine and sciatica pain and show you how to avoid them. We're going to go over the 5 reasons why so many people do stay in that pain cycle so much longer than necessary. And then we're going to get into the 6 strategies that we've had the most success with, including our corrective movement strategy, which has really been a game changer for us and our patients. And I am not just being a salesman, I am very genuine when I say that. So if you've already spent, over 2 minutes with me, I really think that you'll benefit from the 1-hour webinar. We've put a lot of work into it, and we really think it's going to help a lot of people.